This is November 15th, 2023. I'm Charles Clinton, and I will talk today real short which stethoscope is right for me. So if this is something, if you have a stethoscope, if you've thought of buying a stethoscope, yes, this video would be for you. What do I bring to the table? Well, I graduated medicine in 2013, about 2012, 2013. After that, I went into cardiology residency, and now I'm in internal medicine residency in the United States, and I'm planning to go into cardiology residency again here in the United States. Your question might be, why didn't you do cardiology in Costa Rica and just continue cardiology in the States? Because that's not an option in 2023. You have to first have your United States internal medicine title. And the other thing is that I love medicine as a whole, so I'm making the best out of all this journey, so I'm actually enjoying it. Yeah, I've been studying for a long time, and basically, I do think I have something to bring to this table because I've always tried listening to all those heart sounds. So by now, I've listened to thousands of heartbeats, thousands of lung sounds, because there's no single, well, maybe there's a patient I've seen in the past, I'm not sure. Yeah, there probably has been a patient I've seen in the past I haven't auscultated, but it should be like a patient that came in and they just had a little nail break and they were concerned if they had to have the nail removed or not. One of those things, and you maybe would avoid, let me listen to your heart, wouldn't make much sense. But in general, I'm one of those doctors that always has the stethoscope on and always will listen to those heart sounds, because I think it's important. I think it's a good practice. And remember that only through experience will you master or try to master any art. So why am I doing this talk in the end? I'm on my free day. I'm on my day off. I wasn't planning on talking about this, but I'm suddenly doing this small presentation for you guys and talking about it. Okay, the reason is because I just saw a video on YouTube of someone giving a review of a stethoscope. And I've seen the review, and the animations are great. It's a very well made, even sponsored video, but the information isn't factually correct. There are a lot of things I was even thinking on going on the comment section and being like, that actually doesn't work like that. But I thought that it would be better for me to make my own video because I think you might find it helpful. It might help you in your journey. So let's go on to talking about this. Do you really need a stethoscope? So how would I answer this question? Okay, if you ever have had to do BLS, basic life support, and further, right, ACLS, PALS, all those things. If you have to have that license in whichever job you are, right, not because it's a hobby, because I do understand that many people, you might work in a call center and they ask you to do basic life support. Yeah, it doesn't mean you need a stethoscope because not necessarily. But if you are in anything that you might be called to show me your ACLS thing, show me your BLS, basic life support. If you're in anything related to that, or that you might need to be in a code-like situation, I would expect you to have a stethoscope. So any doctor needs a stethoscope. Any nurse needs a stethoscope. Actually, a way which you can distinguish usually, and this oftentimes works, a good professional from one that isn't that good is, do they have a stethoscope on? If you're seeing patients in the hospital and you don't have a stethoscope, how many opportunities to detect things are you losing? So when I'm walking around the hospital, because sometimes we have noon conference and I leave my stethoscope in the locker, I feel bad about it. I'm like, what if I need this stethoscope? What if I'm called to see a patient and I don't have this device with me? Will I just roll a piece of paper and do as Laennec did? I think it was Laennec, right? And that's how the stethoscope ended up being invented. No, no one will do that. Will I put my head on the patient's chest? That won't happen. So you want to have something that aids you to listen to the heart sounds, to the lung sounds, to the abdomen. Does this patient have an ileus? No, I palpated. They don't. No, that's not the way. You have to listen as well. Okay, so basically, it's important to have a stethoscope if you're in any health-related field. So that's what I would say. Another person who might need a stethoscope, which you could also make a case, sometimes you have a family member that they have several health issues, and you aren't a doctor or a nurse, but you are into all these things of how to monitor your family member or this person, and you might actually have a stethoscope because you can listen. Okay, now there's a little more congestion. I think it's time to call a doctor, and you add that to 2-kilogram weight gain. All those things. I think it would be a good idea to possibly have a stethoscope, right? Okay, so those are the people who need a stethoscope. Anyone walking around in the hospital seeing patients needs a stethoscope. Is it outdated? Is it something that is useless? The answer is no. The only person I would be okay with not having a stethoscope is if you tell me, I don't have a stethoscope because this is my POCUS device, this is my ultrasound device, and I'm doing an ultrasound on all the patients I am seeing. Okay, if you say that, I'd be like, okay. Why? Because ultrasound is sound. So it's sound to the next level. Sound you can actually see, and you can actually hear if you want it, and you could actually interpret. It's way more sensitive than a stethoscope. There's an option where I'd be fine with you not having a stethoscope. If not, please have your stethoscope with you. Okay, so now artificial intelligence worked to the point I was expecting it to. So this happened a couple years ago. I have a whole lot of pictures of everything throughout my journey in medicine, and I thought that in the future, someday you would be able to search keywords and it would show you certain things. And actually, yes, that happened, and I'm glad now that I kept on taking all these pictures and I didn't just erase them. Now I have dozens of thousands of pictures on the cloud, but I can go back to these moments. So I just searched the word stethoscope, and I'll show you some of those relevant pictures. So for example, this one that you're seeing right here, as you can see, I have a little bit of allergy, but this one that you can see right here, these are one of those stethoscopes, I believe, or I'm not sure if that's the brown stethoscope, but these things are things you just place on the chest, and you can listen to the heartbeat or to the lung sounds or all that on your phone. Would I recommend this for a medical student? Probably not, because the ones I have tried, they are still lacking technology-wise, and they still aren't at that point yet, unless someone can make the case here in the comment section below that there is one that is excellent. I still haven't seen it, and if there is one, I would probably even consider it, possibly. Because if that was the case, it's a little pill you can have in your white coat, and you wouldn't have to have your stethoscope around. Of course, it would be digital, it wouldn't be analogical, so it would need batteries, and you would have to charge it and all those things, right? So yeah, that's one option. But now let's go on to the ones I have the most experience about. So I've been using stethoscope since 2010, about 2009, and on every single patient. So if you know me, you've seen me in the hospital. If you've seen me in the hospital, you cannot say you've seen me without a stethoscope. There has just been one or two occasions where you might see me, oh, and you tell me, like, where's your stethoscope? And I go crazy because I left it somewhere, but that's usually not the case. So, okay, this picture right here, 2018, I was in my cardiology residency in Costa Rica. This is a Master Classic 2 stethoscope. So, why did I buy this one initially? This was my first stethoscope I had. I bought it back in 2008, 2009, and it actually started listening to patients around 2008, I would say, first with my family, then I had the clinical rotations and started listening to actual patients. I bought this Master Classic. So in Costa Rica, the go-to brand, at least at that time, was like the Littman brand. I know that there are other great brands, and depending where you live, there's others, but I'd say that worldwide Littman, and I think there's a German one called ADC, if I'm not incorrect. Those are like the strongest ones, and there's one that is upcoming that we'll talk about soon. But basically, this Master Classic 2 is like mid-range. So there were these stethoscopes that are the ones you see on the movies, right? So the ones you see on the movies are the ones like, oh, wait a second, this is a doctor scene. Do we have a stethoscope? And everyone's like, oh yeah, the doctor needs a stethoscope, right? So someone goes and to the supermarket, to CVS, and finds, oh, you have a stethoscope, and they have these shitty stethoscopes. Okay. So I didn't want to have those stethoscopes that you see on usual commercials, banners, movies, not well-made movies, of course. And I didn't want that because I was like, no, that doesn't work. That's useless. They look so small, brittle, light. I thought they didn't work at all. So I was like, no, I want something better. So then came the Master Classic 2 series on that occasion. I was like, this should be good. And I also looked into the cardiology series. So after the Master Classic came the cardiology, Littman cardiology. And I was like, wow, cardiology, that's incredible. But I'm a medical student. If I buy a cardiology stethoscope, it might be even better than my attendance, and I might be expected to listen to all these different crazy things, and I have no idea what I'm listening to initially. So I was like, no, I have to work up to it. I have to gain the reps to be able to have around my neck a cardiology stethoscope. So that's why I bought the Master Classic 2. I do not repent. I think the Master Classic 2 would have been great. If I would have bought the cardiology one, it would also be good. I have tried both of them. Is there a real difference? Minimal. There's a mild difference. It's not like you can, if you have a cardiologist, and the cardiologist has the cardiology Littman series, the top of the line, and they left their stethoscope somewhere in their locker, and you have a Master Classic 2, they'll grab that Master Classic 2 and listen to all these same crazy things on it. But if you have this other one, the ones that you see on the movies and on publicity and all those things, they'll be like, what's this? What's this? I need, yeah, I can listen. There's a murmur. There's a systolic murmur, but, and they look at you with a face like, you're listening to patients with this, right? And you're like, yeah. So that's not the go-to device, unless you just need the stethoscope to check blood pressure, to see if the patient's heart is beating, to see if the bronchospasm is very severe or not, and to see if the crackles are moderate to severe. If that's the case, go ahead with these simple ones. Actually, with my experience, I have one of these simple stethoscopes that are very, very light, that my hospital has them because in the COVID pandemic, they are the ones that you just use once and then you throw them away. I have one of these in my locker. Sometimes maybe my neck hurts a little because whatever, I worked out or whatever, I'll use this one throughout the day. And in the end, it works. It does work. But if you have a specific patient and you're rotating in cardiology, it's not going to be the best one. If you're not rotating in cardiology, yeah, you can use those lightweight ones and they'll do what they have to do. You'll then roll them however you want. You'll put them in your bag. If they break, if whatever, all good. Okay, and those are pretty cheap. Okay, so let's move on. So this picture you're seeing right here is in one of the hospitals. Every hospital I would rotate in Costa Rica, I would go live in a small, cheap hotel very close to the hospital because I really enjoyed trying to get 1 hour more of sleep, right? So this is something I did. So as you can see, this room was pretty simple, very simple bed. But what I took a picture there was everything I had in my pockets during the shift. So I had this little booklet, internal medicine booklet. I had this charger because our shifts in Costa Rica sometimes go up to 32, 36 hours. You have to have a plan B for charging your phone. Your phone will run out of battery. I had car keys, the Master Classic 2, the wallet, phone, shoes. That's it. Okay, so that was it on that occasion. But a couple days later, I bought this thing. So now I was in cardiology, as I mentioned, and I bought the EcoCore Dual. So this is a new brand I didn't know about, but I learned about it on the internet. I see these ads, and it's like EcoCore, and you could be one of the first persons to try this machine. And I was thinking to myself, like, okay, it looks interesting, but I had already heard of these digital stethoscopes. And I had actually used a couple digital stethoscopes in Costa Rica, which didn't convince at all, and they were quite bad. So I was able to just try those first generation digital stethoscopes. But the reason I bought this one was because I saw a lot of pretty good advertisement, and I was like, this doesn't look like first gen anymore. This probably is already like second gen. These people are probably doing things right. And even some cardiologists were thinking or awaiting this device. So I got it. I was like, I'm in cardiology, let's go all in. So I bought this device. There I was charging it, and in this picture I was like unboxing it as well in the hospital. So here you can see me very glad, March 8th, 2019. So yeah, it was great. It was a conversation starter. Everyone would be like, what's that thing? Is it a cell phone? Is it an ultrasound device? What is it? Do you receive text messages there? How does that work? So it was always nice. Family, patients, everyone would ask you about it. It was nice. Okay, so here you can see that I'm not lying regarding my previous residency experience. Here I'm doing a guided transesophageal echocardiogram, and this was in Costa Rica with the consent of the patient, and you cannot identify the patient, so don't worry about any HIPAA compliance issues. So here you can see that I was pretty fond of my stethoscope, and you would detach the gray part from it and charge it, and it would leave this thing like a little spike that was the digital connection to it, and it looked pretty cool. Sometimes I would do lives and put it on because it was like, oh, it's interesting, it's gonna look nice, and that thing might be somewhere around here. So now I'll take you to 2019, April 9th. This is a picture you don't post on social media because I don't look that good, right? I look tired, I look serious. So this is a picture I probably took some point in time and sent to my parents, like they were, or whatever. I'm like here working, and maybe they weren't sure if I was that day on one of these long shifts, and I'm like, yeah, I'm working. So this was at midnight, as you can see, 12:30, or yeah, 30 minutes past midnight. So this was actually, in one of our resident rooms in Costa Rica. So that was midnight, and I had to keep on working till 7 a.m. Any emergency, it was my issue. I had to work on that, and there was some moments I could sleep in between. And next day was going to be maybe a weekday, Wednesday, and I had to start working the next day from 7 a.m. to 4 p.m. So those are horrible shifts, which I no longer have to do in the United States. because here you cannot do more than 12 hours in a row. So I think that is good. That is good, but there are caveats to that, right? Of course, in Costa Rica, you earn much less. So yeah, it's horrible to go through all these more hours, but that's a way you can actually earn the amount of money you would wish to earn. So sometimes it's necessary. You have to support your family and etc. So why can't we have nice things? Why did I mention this right here? So basically, my Echo Duo survived until 2019. And the reason for it is because, for example, I was in one of these night shifts, so I had a little chance to take a nap. So I went to sleep. I left it in the bathroom right beside the shower. I bear in mind that you are so exhausted during these shifts that sometimes you might leave anything anywhere, right? Sometimes you don't have time for anything. So sometimes I would have it right here. Maybe I was charging it and had it right here, and I was trying to grab something off the floor and it fell out, so I put it right next to me, and I then took a nap. When I wake up in the morning, basically I see it surrounded with water in the shower. So I hadn't put it in the shower. I had put it right next to the shower. So yeah, I got very pissed off because someone put it in the shower, grabbed it up and put it in the shower. There's no other reason. I'm sure I wouldn't put it in the shower. So I texted all my resident chat, like, why didn't anyone take this thing out of the shower before you actually showered? And one of the response I got was that they thought it was a soap. And okay, so that was it. After that, I tried to charge it. It never charged again. And I tried to give it back when I went to the States. So here you can see me doing one of my clinical experiences in the United States, 2021. As you can see, I have another stethoscope on. And what I did is that, yes, Echo company was giving me a pretty good discount at least to get a new device. So this time I said, no, I don't want the Echo Duo. I want something else. I want something that is more versatile, and I want something that isn't as expensive. And I didn't go with the Echo Duo. And I'll give you a simple example right here. Remember, look at this thing right here. If you have this thing right here and you have to go and put on a leaded vest, as you can see, you can put this thing on here and then you'll be receiving the ionizing radiation, and you don't know if that could affect the digital output. So I wanted something that had dual capability. I wanted something that was analogous, but if you want, you can turn this thing on and it's going to be digital. And this gives you the same amount of gain of listening skill, right? It amplifies sounds 40 to 50 times your regular analogous stethoscope. So I prefer to do this. The Echo Core Duo. This is called the Echo Core Duo. They sold me the whole thing. Its diaphragm is a master cardiology diaphragm, and it's attached to this thing. So whatever your diaphragm is, this thing will amplify sound a whole lot, 40 to 50 times, and I think that's enough. Of course, you won't be able to attach this amplifier to one of those CBS stethoscopes, but you just have to look through the specs, and there are many different brands that you can just attach. You can take the diaphragm out and you can attach this thing on. What I liked about this one is, yes, it isn't as versatile as my Master Classic was, my first stethoscope, because my Master Classic, if I have to put it below that leaded vest, you just put it in there, and if there's things pressing on it, nothing will happen. It won't break. It's a hard thing. This thing with this diaphragm, it's a little bit more difficult, right? It's a little more fragile than would be my first stethoscope, and this thing right here makes it a little more bulkier and weighs a little more. So for example, with my Master Classic 2, I had it on it all day, and I never had any neck pain, I wouldn't even feel it was there. For me to know I had that stethoscope on, I had to actually touch or see myself in a mirror. With the Echo Duo, or this Echo Core Duo, I do know I have it on my neck, because after 6 hours of having it there, so your neck hurts a little, right? You do this and you move it a little bit, and sometimes you take it off because your neck is like, oh man, it's hurting a little bit. You take it off and you put it on the table. So just know that, right? So in case you want to hear all sounds, don't want to take it to the max, you don't want to describe the specific little nitty gritty, goes up with something mid-range like the analogous Master Classic 2. But if you want to amplify sound and you want to try to stand out, like this murmur is in the middle of systole, and I think I am listening to an open and click. So I think this might actually be mitral, whatever, right? Mitral, you could say mitral stenosis. You could say, well, systole would be mitral stenosis, mitral valve prolapse. You can differentiate. If you are the person that likes to do the maneuvers, I did Valsalva maneuver, or I did the leg raise test, and now with increased preload, I think I'm listening to this. You need these digitalized things to add to your game, and you'll look cool, and you'll also be able to add to it, and you'll say, hey, wait a second, let me turn on this thing. You touch the button, and you're like, oh, I amplify the sound. You first listen to it without amplifying, then you do the same thing, amplifying the sound, just turning the digital thing on, and you can grab a lot of experience and even improve your game. So this is the stethoscope I have nowadays. I'm very happy with it, and this is the best bang for your buck I can devise nowadays. I just have to add that I missed something from my Echo Duo. So my Echo Duo right here had a 1-lead EKG tracing, meaning that wherever you put that thing was like an augmented unipolar lead, like you would say AVF, AVL, AVR, right? So if you would put that just on where V6 would be, you would get a sort of V6 lead. I love that because it's a little bit, it's like game changing that you can actually get a lead and you can be like, oh, that's cardiology right there, or that's advanced practice right there, right? So yeah, it would help me detect atrial fibrillation, but I got into a point where I can just palpate the pulse and listen to the heart, and I'm like, this is irregularly regular. This is either atrial fibrillation or this is an AV block, which wouldn't be a Mobitz 1, it would be a Mobitz 2, or this is complete AV dissociation, which, okay, or this is extremely marked sinus arrhythmia. So yeah, but you can add to your game. You can get the trace and you can take a little picture of the trace and you can send it to your friends. You can be cooler, right? So I do understand. I do miss the EKG tracing for that thing. Also, if you have a family member that is pretty sick, let's say you're overseas or you're abroad and you want to monitor your grandmother, right? And you're a doctor, you want to explain to mom, how can we monitor grandma? An Echo Duo could actually help you. You could teach them where to place it. Then you can get the EKG tracing, and you could be like, okay, thank you. Send me another tracing in a couple of days, and oh, she's in AFib, she's not in AFib. Instead of having to buy a huge EKG thing, right, or implanting a loop recorder on her, or taking her to the hospital, blah blah blah. But those are other options to take into consideration in other contexts. So now let's go on to the last thing, which is the reason I am doing this review, because I am seeing this new Echo product, which is called the Echo Core 500. So I haven't used it. I would love to use it. I want to see if this would actually make me change my opinion regarding the stethoscope, because could this make me think that the Echo Duo, this thing right here, or something like it would be worth it? Is this new device better than this Echo Duo? It might be. So you can see on the screen right here, this thing shows you on the screen the EKG tracing, but how will you interpret that? That's the question. You can't see a millimeter thing. How will you interpret it? It's a little bit difficult, right? And if it is not FDA approved, which it is not, it'll take years for this thing to be approved in ST elevation, ST depression, all these things. It's going to be mostly descriptive. But of course, if you can gain experience on this and this actually shows you these things, it'd be great. But I think that won't be so reliable initially. This is probably the first generation of this thing. I'm just seeing it for the past couple months. It does give you the EKG tracing, so it does the same thing. Once again, it is fragile, and I've seen someone talk about this device that it does give you a lot of interference if the patient has clothes on or there is chest hair. So it probably has similar things that are limitations to these digital devices. If this device is analogous, so meaning you don't necessarily need it to be charged for it or turned on to work, you can just listen to it as a regular stethoscope. And if you need to turn on the digital capability, you can turn it on. I think that's how it should be. If you can only listen to this thing when it is turned on, I wouldn't like it because sometimes these things run out of battery. Sometimes the connection isn't working. You get this interference or white noise. So this thing should actually work with you having it also turned on, as my current device does, this thing right here. Okay. What's the other thing? Yes, the EKG tracing. Of course, if you're not going into cardiology, if you're not a nerd that wants to see these EKGs, so you probably don't need this one. I've heard it's like $30 more costly than this one right here. So I would have expected it to be way more expensive. So there might be a catch. Maybe it's not as good as they thought it would be. So we'll think about it. Leave me your comments here in the comment section below. Tell me if you've used it, what you think about it. But yeah, I wouldn't start off from scratch with this stethoscope probably. The other thing is that if you're in the emergency department setting, if you were like in a place in Costa Rica that you have to see 5 patients at a time, and you can't ask them, please remove your shirt. Please, we're gonna we're gonna shave your chest here. I wouldn't get this thing. If you have time and you have all those things, I would get this thing, because if not, you'll get a whole lot of interference and you won't be able to listen pretty well. So what would be my recommendation currently, based on all the thousands of patients I have already auscultated and seen? This thing. My EchoCore Duo is pretty versatile, so I can use it 2 ways. This is a picture from the internet, but because you can see that it's attached to another diaphragm. But I also do this. I've done this for a couple of weeks, and sometimes I do this, sometimes I do this. So most people don't know you can actually do this with the EchoCore Duo. So basically, what can you do? You can just use the stethoscope on your neck, or you can also put on your AirPods Pro 2nd generation or 3rd generation. I'm not sure if there's 3rd, but I have it here. I have them. My AirPods Pro 2nd generation. Their noise canceling capability is crazy good. So what I can do is sometimes when I'm in extremely loud situations, I just detach these two. I just keep these two united. I just put them on. I don't have it around my neck. I just have it in the white coat, and I put on my AirPods. And I go to see patients like that. I have it connected. I might be listening to music for a while. When I'm walking to the patient, I get to the patient. I just activate it. This thing is connected, and I just listen to the heart, to the lungs, everything. It's incredible. Everyone can be screaming around me, and I just apply the noise canceling, active noise canceling for the AirPods, and you listen so well to everything. I think that's one of my most preferred methods of using this thing. You have to give the disclaimer to your attendant and to the people that you're working with that you're just not having your AirPods in there while you're around them because you're just not paying attention. No, you have to tell them, this is how I'm using my stethoscope right now. I'm not listening to anything. I'm paying attention to you. Then you go see a patient and you just listen to it, and it's incredible. That's an alternative. Or you can also do this thing right here. I think this is the best option currently. You cannot see the EKG tracing, but if you're in the hospital, you can ask for an EKG. If you're like me, if I could add EKG tracing to this thing, I would do. So maybe this thing right here might be the answer for me, but I would like to be able to just maybe detach this thing and use this thing right here. If I was able to detach these 2 things and use this thing, have it in my pocket and connect it to my AirPods, I think that would be an incredible choice. I don't know if that's a capability this thing has. If not, you guys at Echo, I'm giving you very good ideas, okay? So that's it, and hope you liked this video. Give me feedback, etc. See you in the next one.